Welcome to the Protecting Your Nest podcast. Do you want to have better sex? Well, today's episode will help you do just that, not just because it's one of the most enjoyable human experiences, but because it's another way we can protect our nest. In fact, my wife and I joked when I told her about today's topic that maybe, just maybe, one of the S's in my NEST acronym should remind us of the importance of having a healthy sex life. So how does sex help protect us and protect our nest? Well, the benefits are many. Healthy sex actually supports our immune system, improves our bladder control in women, reduces blood pressure, and decreases heart attack risk. It's really a great form of exercise. It also decreases pain, decreases the risk of prostate cancer, and many of you are aware that it also reduces stress and improves sleep, which is part of my NEST acronym as well. So I'm so happy to have a guest who will provide some additional knowledge so that we can receive all of those great benefits. Today's guest is Brooke Hazen. Brooke is an organic farmer, lifelong athlete, physical coach, and a health and fitness enthusiast. A Southern California native, Brooke grew up loving the ocean and the natural world. His affinity for the land, healthy living, and natural foods led him to study agriculture at Humboldt State. In 2001, Brooke realized his vision to grow nutritious organic farm-to-table foods under his own brand when he purchased 88 acres of pasture land in the beautiful Northern California farming region. He now cultivates apples, citrus, medicinal herbs, and high polyphenol olives, and has now authored his new book, You Are Not Broken, a holistic guide for men and women to heal the pathways of sexual dysfunction and restore relational harmony together. With that, Brooke, I welcome you to the Protecting Your Nest podcast.
Thank you so much for having me on. It's an honor.
Yeah, well, I'm excited because so many of my patients come to me, and it's not just the men, the women as well come to me, and they're really interested in learning more about their sexual health. And I really think it's important that we provide a pathway for them to heal in that area. And
I'm depending on women to be there to help spread this message.
Wow, so important. And they are just as vital on this journey. And I know that for so many people who start to dedicate their life to helping people this way, they may have their own story to tell. So let's start our conversation with the audience hearing your story. Talk to me a little bit about the story of healing that you actually had personally.
Okay, that's a great segue into this. A few years ago, I started experiencing the symptoms of erectile dysfunction, and I really had no idea what was happening. I was afraid. I went immediately to Western medicine for answers, which I was unable to find. And I went through a process of experimenting with pharmaceutical ED drugs, but none of them worked well, and they all had side effects. And so anyways, I went through a depression. I went through a deep depression for weeks at a time. And I really didn't have any answers for what was happening. And so I got to a point where I just completely had no answers and gave up. At that point, I've always been a spiritual person, and I prayed to God. I had never had a situation like this where there was something so gripping and caused a loss of confidence in myself like this, and gone to God with such a task at hand. But that's what I did. And this time I prayed for a healing miracle, not just a specific drug that could help me, but a true miracle healing. And when I did that prayer and I let go to God, it started a whole process for me, which continued with this letting go. Many of the first healing modalities that I go through in my book all involve letting go. They involve letting go of our addiction to pornography, to orgasm, to mating-based behaviors, to what we eat, to how often we eat, and even letting go of our blood with blood donation, which I'll go over with you at some point in this podcast. But by letting go, we're able to lay ourselves bare, stripped of all our addictions and preconceptions and cultural peer pressure, and lay ourselves bare in front of God, so that we can allow the light to come into us and heal us. God is really the ultimate healer. That is what is behind all of natural healing. And when we are able to let go and let God in, we allow the natural intelligence, which is innate in all the cells of our body, to do its light work and fulfill its mandate of restoring balance to our body, mind, and soul, to perfect balance. So we're just providing the building blocks and the opportunities for our body to do what it knows best to do, rather than importing what we feel is best for our body to do. And as you know, what you're practicing with holistic health, Western mainstream medicine approach through pharmaceuticals and surgeries merely hover around the symptoms. They do not actually get to the root cause. And through my journey, I was able to not only get to the root cause of what's causing neurological and organic ED, but I was able to actually go beyond that into overall physical, mental, and spiritual health, as well as relational health, because it's all tied together. Holistic health really encompasses everything, which is why I feel holistic health is the best approach to ED, and which is why my book offers, I believe, maybe one of the first opportunities for people to follow the protocols in my book and be able to not only heal themselves sexually through a holistic means, but also a whole journey beyond that of reclaiming their vibrancy, their youth, and their vitality, which is a lot what you talk about too, with the diet and with exercise. And so I go into all that in the book.
I love it. And when I think about the rope and the acronym, it deals with emotions, and the whole Nest and Rope acronym is really functional medicine, foundational, the roots of the functional medicine tree. So it really speaks to emotions. But if you really look at that, the emotions also it really speaks to your spiritual journey as well. And I think a lot of people who I see in clinic are very solidly grounded in their faith. But what's really important, besides understanding the root causes of why we get sick, is to really understand that your journey is not just to acknowledge you have a relationship, a spiritual relationship, but it's also to understand you have to do your part, right? So it's a partnership. So you have to, so for anybody listening who has ever, said a prayer, or asked the universe for help, you really got to do your part too. And some of that is doing your own research, the same kind of research it sounds like Brooke did to find answers. So if you seek, you shall find. It's very simple. So I really appreciate you sharing how you kind of came to this place. And I also know that a lot of people who suffer from, issues around sexual health, they have expectations about what their sexual performance should look like. And some people, think that, as I get older, things are gonna be the same, or they're not gonna work at all. So I just want you to talk a little bit, based on your research, what are some expectations for a person as they age in terms of what they should expect sexually? Because I think if we don't understand some of that, it's gonna have expectations that are maybe too high, or maybe expectations that are too low. So what's your thoughts on that?
Well, I feel if people really do let go and embrace the healing modalities I recommend in my book, and they practice all of them, they're going to see massive transformations. And, what I want to talk about first is a lot of people don't understand what's happening with pornography. But that's the first place I started. And to heal these neurological dysfunctions we have is the first step, because dopamine. We talk about dopamine. It's an interesting neurochemical and receptors because dopamine really is like the will and the drive we have in life. But it doesn't necessarily satisfy us. So what's happening is it drives us in life, but people are actually getting in dopamine addictions where they're using bad habits. So if we have good habits and we have normal levels of dopamine and we're balanced, that's a healthy, good thing because we can get satisfaction in life through positive behaviors. But when it goes towards negative behaviors, it can be incredibly depressing for us and it can deplete our dopamine levels. So the first thing to understand, and I'm going to go through a lot of interesting things in the podcast today that are cutting edge, but there is a massive epidemic happening that's doctors in Western medicine and really even natural medicine are unaware how to resolve. And that's the epidemic of young men who should have no business with erectile dysfunction, experiencing erectile dysfunction. Now, they have no answers for this. So what they do is they automatically prescribe what the only solution they have, pharmaceutical EDs, drugs. And basically there's no solution. They're giving these young men a lifetime prescription of EDs with absolutely no answer for or solution for how they can recover a vibrant sexual health life ever again in their life. So what I'm doing is I'm empowering all of us through my own experience and through the research and through the healing modalities I suggest to empower themselves that we do not have to accept a lifetime prescription of pharmaceutical ED drugs. We can have a vibrant sexual health life into old age as long as we strip ourselves of these addictions. And that's the first part of where we start, is stripping ourselves of the dopamine addiction to pornography, as well as orgasm, which is ejaculation for men and orgasm for women. People aren't aware of these effects, that powerful effects these have, but with pornography, it's a superhuman stimulus. And it's not just the actual watching the pornography, it's actually the engagement of ejaculation or orgasm with pornography that's so powerful. And what happens is it's actually depleting the dopamine levels and receptors in our brains to the same levels as it is for morphine and cocaine addicts. The brain actually does not differentiate between a physical addiction and a neurological addiction. And that's important to know because most people write off pornography addiction as non-existent or not a big deal. But actually people on a massive level right now in the West or throughout the world are experiencing a neurological based erectile dysfunction, and they're in an addictive cycle just like physical addictions, but nobody's really acknowledging it. And how can we expect men and women, when they have an extreme dopamine addiction where their dopamine levels and receptors are so low, to be able to become the vibrant, youthful, vital beings that God meant for us to be when we're trying to deal with an addiction? So that's the first step, is to recover neurological health. And so the techniques that give you a vibrant sexual health, most of what we see happening to men and women of all ages can be healed through just the neurological healing modalities I recommend in my book, which is, there's a big movement now of young men and women that have figured out what's happening, and they're taking this leap of faith of quitting pornography, quitting masturbation to pornography, and the next step is to graduate on to semen retention. And because again, ejaculation is something we're not aware has such an immense toll on men. It is incredibly depleting, physically, mentally, relationally, and we just aren't aware of that. And so graduating onto semen retention practicing semen retention, abstaining from pornography. These are all, again, things of letting go techniques where it doesn't cost you a cent. We're just stopping the addictions, addictive behavior, these which cultural peer pressure makes us feel is healthy for us, but it's actually poisonous to us. All these things are poisonous to us. We're also, we'll get into food too. Like you talk about how important diet is. I like to say, it's what goes in your mouth, stupid. I'm sorry about it's sort of a joke, but it really is. I mean, all these massive things that are happening to us as a people, nationally and throughout the world, at least in the West, predominantly, are related to what we eat, breathe, and drink. And that could be what we eat, as well as breathing in or drinking heavy metals, which I will talk to you about, is now being linked with arteriosclerosis, and causes all kinds of toxic behavior patterns that are similar to psychological diagnoses and neurodegenerative disease symptoms. And we'll talk about that. I have solutions for all this. I really have solutions. Nobody should be dying of heart disease, heart attacks anymore with the modalities out of my book, with the chelation IV therapies, the trial to assess chelation therapy, government studies that have been done, other studies that have shown the amazing benefits of chelation therapy. Donating blood once a year even reduces the chance of heart attack by 88%. Now, why aren't we telling people about this? A study of 22,765 people showed with a full course of disodium EDTA, showed an 87% marked improvement in vascular disease. Of 363,000 of the 407,000 patients that were tested in this study in 1991, they estimated that 363,000 of those 407,000 patients could have avoided bypass surgery. The TACT-1 study, which is the trial to assess chelation therapy, the first study, the second study is ongoing, but this first study showed a 51% reduction in cardiac events and a 43% reduction in the mortality in patients with diabetes. Now, I'm going to repeat that again. The TACT-1 study, a government study, showed a 51% reduction in cardiac events and a 43% reduction in mortality in patients with diabetes after receiving a full course of disodium EDTA IV, which is a non-invasive, natural healing modality. I'm a big fan of IVs. I have a lot of other, donating blood regularly. I encourage everyone to get out there, and I do it. I donate blood regularly. I donate 3 times a year. And what it does is donating blood, it reduces oxidative stress and it increases antioxidant capacity. It reduces the iron levels, which are equated with, a lot of diseases, So these are simple things we can do. So all these things are free, but except the IVs and we start to build up and we start to add to our sexual and physical health. Now, I have to say right now that sexual health and physical health are inseparable. I mean, we're talking about our neurology, our physical body, our overall body organism. The health of that is inseparable from sexual health. Now, there's this myth that somehow, a misconception really, that really Western medicine has made us believe that you can take a pill and you can heal your sexual function. That's not how it works. A pill can never replace true healing. It takes dedication and time and energy and resources to recover your full sexual function. Now, the easiest thing is giving up pornography and ejaculation orgasm. That is simple, and that's the first step. Once you do that, we can start applying this renewed vigor and energy and dopamine levels and drive we have in our life towards our physical health, towards adding things in like weightlifting, pellet testosterone replacement therapy, balancing. This is more for older men now, I'm talking, but pellet TRT is excellent. We can do weight training, which has been linked with decreasing that gene or that trigger that causes obesity. I was just listening to a study from Dr. Richard Johnson, who's been studying obesity for 25 years. And he's talking about how, just like you talk about, that the glucose trigger with soft drinks, which are dehydrating but loaded with sugars, is one of the worst things you can do. But also the refined flours and grains like that. He's also mentioning the reducing salt intake, because dehydration, which I talk about in my book, and how important it is to drink water, that's linked with healthy sexual function. Making sure we're hydrated well, and also weight resistance, like I just mentioned. Those are what he recommends. Just like you recommend with your diet. The diet I recommend is very similar to yours. You were vegetarian for 7 years, I think you said, and I recommend a plant-based diet that is low in just some whole grains. Definitely not refined flours, and and intelligent eating. Like superfoods. If you're gonna have grains, whole grains like quinoa. And it's funny because people they're terrified of diet changes, but there's really nothing to be afraid of. Our body and our brain are so plastic and resilient that it's meant to be challenged. And once you go through that challenge, you'll find that everything changes in your brain chemistry. Your addictions change to healthy lifestyle choices, and you actually enjoy those foods. You actually appreciate it. Whereas when we're loading ourselves up with 3 meals a day and unhealthy diet choices, we actually start to become numb to our healthy habits. And that's what I talk about in my book. I want us to reclaim our vitality, reclaim our youthfulness and our vibrancy. And I want us all to lay our fears at the feet of God and ask ourselves, what are we afraid of? What is stopping us from making these choices? Now, I know that decreased, chronically low dopamine levels are a hindrance to wanting to make these changes in our life. And that's why the first step is to strip ourselves of these addictions, these negative habits we have in life that our culture has taught us is healthy, but is actually poisonous to us. That's the first step. When you let all that go, you're now able to reclaim that vitality and vibrancy. I just want us to really ask that question right now, everyone listening right now. What is blocking you from becoming your ideal self? Because I can assure you that what you see as your ideal self in the future or in the distance and where you are right now is not as far as you think. And I'm testament to that.
Well, I am blown away with, some of the talking points, because nobody who, decided to watch this video or to listen to the podcast would have thought that, donating blood would have been one of the topics to suggest would be helpful. So that's pretty amazing. And we just had a notification fairly recently about the fact that a lot of people are not donating blood during the pandemic. And so there's a little bit of a shortage. And what better incentive than to help somebody else while helping yourself? So that was a new one for me. That's definitely a new one. I'm curious briefly about this depletion. I mean, I think most men understand that when they're active, and I would argue for both sexes, when they have an orgasm, that's going to deplete them. So I know physically there's a change. And when you spoke about that, was there more to it than just that? Because is there more that you're saying you're going to deplete yourself up? Just want you to
so it's a massive transformation that happens. It's a process of decreased dopamine and increased prolactin that weaves up and down after an ejaculation or mainly an ejaculation. This is much more fierce for men than for women. I've found the effect is very intense for men, that this process of dropping drastically decreased dopamine and increased prolactin weaves up and down for up to 2 weeks. In fact, some of the biggest reverberations can be in 2 weeks. Now, most men are ejaculating several times a day, or at least once a day, or at least every few days, with the habits we've developed in our current Western culture. So what that means is we have overlapping dopamine crash cycles. Now, what this does is it causes an immediate process of replenishing the vital sperm that's been lost, pulling all the most precious resources from our body. Because the sperm, the procreation is what our mammalian brain has taught us to put above all else, and which ties into the mating-based behavior. So, it has to do with relationships and versus bonding behaviors, and that's a whole nother topic that I get into in the book. But basically, going back to what you said about what happens is, an extreme drop, and it causes fatigue, mood imbalance, and also an inability to connect in the relationship, or really in life, because we are losing that dopamine. Every time that we watch and ejaculate to pornography or orgasm pornography, we are desensitizing ourselves to life, to the actual pornography, and to our relationships.
Yeah.
Because it's a process just like cocaine and morphine of an addictive cycle. What happens is men and women who never imagined themselves watching certain types of pornography start to have to watch that to keep this same trigger of dopamine happening. And some young men get to the point where they cannot even, men of all ages and women of all ages get to the point where they can no longer actually get aroused to even their most specific, neurologically specific pornography that gets them aroused. And because that's what happens is, the reason pornography is so strong, the addiction to pornography, is because it's so specific to each individual's brain. Each one of us has a certain type of thing that gets us aroused. Well, pornography insidiously fits that desire in a poisonous way, where it eats away at our dopamine levels.
Yeah, that's very powerful. So thank you. Again, our minds are everything, and people really think guys are different than women, but we're emotional. What we think affects how we perform. All of these things are true. And so I appreciate you kind of going in that direction. And I do agree with you that diet is so critical. And during those 7 or 8 years when I was vegetarian, I felt great. All the studies that I use when I compare low carb to low fat clearly state that they're both very helpful. So I think as people are listening, and a lot of my listeners are low carb, but as people are listening, you really want to listen to your body. Your body will tell you the answer. And we really just want to stay away from processed foods, things like that, because when you eat real food, most of the time, whether you're doing low carb, low fat, Mediterranean, whatever, you're going to be in such a better place. And again, it's a holistic approach. So we eat well, we move our body, we reduce our stress, we get enough sleep, we start, and maybe learning about some of the stuff we'll talk about now in terms of what's available. But before we maybe talk a little bit about some more of the technology piece and some of the advances, just briefly, you mentioned Viagra a moment ago, and men are more comfortable talking about, issues around sexual health now because we have medicine. We can destroy pills at this stuff, which is not the best approach, but it does lead to discussion. So, but I know that conversations around erectile dysfunction can make people anxious, can make people feel depressed, partly because they may be concerned about their ability to perform. But I guess I want you to comment a little bit about how important it is to talk about these issues, whether you're in clinic or at home, because if we don't talk about these issues, there won't be a solution. So talk a little bit about how important that is.
So, I've gone through the journey along with many, many men and women, hundreds of thousands at this point, that have joined the NoFap movement, which is NoFap is a funny acronym for basically no masturbation, no pornography, no masturbation, no orgasm. It's called no PMO for short. So that's no pornography, no masturbation, no orgasm. When we all go through this process, it's a very, very difficult process. Like our food addictions to dopamine, all these things are challenging. That's why I encourage people to, first and foremost, look to God for guidance, because we're going to need that strength to make these massive changes. Basically, once men and women go through this challenge, it's usually a 90-day NoFap challenge of quitting pornography, masturbation, orgasm. It's important during that time for men and women to, because I include women because women also have addictions to pornography, and they're in the NoFap movement too. But it's important for anyone in this process to seek coaching from people that have been through this process, as well as talk with their partners about what they're doing. And there shouldn't be any shame. That's the thing around pornography addiction. It seems like there's an extra amount of shame because people don't understand it. But really, this is no different than an addiction to a drug. It really is a drug on a neurological level, and has the same exact cycles of dopamine depletion that drugs give you. Being clear with your partner about what's happening is incredibly important. For women that are hearing this podcast and reading my book, bringing this up to their man that may be addicted to pornography is really important, because the statistics are that weekly 84% of men and 25% of women are watching pornography weekly. There's men that are literally having a relationship with their iPhone and their iPad or device because their brains cannot differentiate between what they're watching and ejaculating or masturbating to and what's reality. So they actually believe they're having a successful campaign of spreading maximum genetic diversity with the most beautiful women in the world. And their heads are buried to their phone while life is passing them by in reality.
Yeah, and
that's what's happening.
Yeah, it's the extreme of pleasure, I guess. If you have this extreme scenario that you're experiencing and visualizing, again, at some point, the real person in front of you is not going to have the same impact, and you may have a skewed view of what a healthy sexual encounter should look like, because what's happening with these movies, I'm sure, is a whole lot of extra, a whole lot of sensationalism in some ways. It's all kind of orchestrated in a way, and if that's required every time you're intimate, that I could see how that's going to be a huge problem. So
yeah, it's intentionally geared for men's neurology.
Yeah, I'm not surprised, and that's not a good thing. Yeah. Your thoughts. So let's talk a little bit about some advances. I did have a guest on a previous episode. I think it was episode 73, Dr. Tracy Gappin, and he talked about the James wave technology, where you use ultrasonic technology to improve the blood flow. Fairly new. Most of the urologists in my health system, they're not really up to that yet. But anyway, nice to know that there's things out there. So I guess what I want to dive into a little bit is let's talk a little bit about some of the things that you have found that are available to people, some old, some new, you probably are like, I hadn't really heard of that before. Because what I really love about a functional medicine doctor in training. I'll be finished with my master's in nutrition this year, right? I'm hoping that as a doctor in training, I'll have additional tools that I can bring to the table that will help patients. You always want to be that doctor that could figure something out that the other doctors couldn't, right? Or any other clinic. It's not because they're not smart, it's because you're open to seeing different things in front of you. Like you mentioned earlier, like look at the research, and the research says that this chelation therapy works. I mean, but what conventionally trained doctor would even be thinking about that, right? So, so let's talk a little bit about what you discovered so people can kind of start to add this to their list of things to consider.
So I started alone from scratch because I had no roadmap in front of me. I had God by my side, and I had a willpower and drive to want to heal this naturally. I had to. I didn't have any other choice. I was facing the devastating loss of my sexual health unless I found a holistic modality. So it's important to remember again that there's sort of two different kinds of ED. There's neurologically based ED, which is called porn-induced erectile dysfunction. I've been talking about that. And that's where semen retention is actually incredibly healing for erectile dysfunction. And so that's one of the modalities. Two of the major modalities we practice is that I recommend in my book is, refraining from pornography and refraining from ejaculation during sex. That's the neurological side of ED, and can resolve definitely most of the younger men's issues, but I truly believe that it can resolve a lot of older men's issues too. Now, for older men that still feel like they want to reclaim some of this vitality, we're getting into what's called organic ED. So the mainstream Western approach through pharmaceuticals is to target the endothelial system. What we look for as basic markers with ED is our hormonal levels, testosterone, which is why I address that with pellet testosterone replacement therapy, which is, I don't know if you've heard of pellet testosterone replacement therapy, but it's the most natural form. I believe it's even made from plant material, but it actually is very consistent and with your body's cycles. So it pulls consistently from your body what it needs, as opposed to injections or patches. Now for women, that pellet TRT has been shown to reduce breast cancer tumors and to alleviate all menopausal symptoms. So they'll look at hormonal, they'll look at any sort of venous leaks, which is usually not an issue, but you look through an MRI for that. And then they'll look at the endothelial system. So I started looking at the endothelial system, and basically what I've come up with was antioxidants, IVs, figuring out why, getting to the root cause of why we are not functioning in our nitric oxide system in a holistic way. Like we could keep, jump-starting our nitric oxide system through pharmaceuticals, but what's the source of that nitric oxide dysfunction in the first place that pharmaceuticals are simply trying to just cover up as symptoms? So what I found was that there are, through what we eat and through heavy metals, I've found that heavy metals are a big culprit, that we're creating oxidation and free radical damage to our endothelial system. We're basically creating a conglomeration of plaque and heavy metals and calcification that we can resolve with IVs. We can resolve that with, as the studies, TACT1 study shows, and these other studies, and tons of experiential evidence shows, we can actually break apart with EDTA the heavy metal problem, as well as the calcification problem. And then the cholesterol problem we can resolve with plaque X, which is phosphatidylcholine, or PC for short. It's called phosphatidylcholine. And this is a natural, PC is a natural, makes up all our cell walls. So it's derived from soybean, this is natural. EDTA is a chemical, but it's, sort of a greenwash chemical. We're using it for holistic reasons to get to the curative, source of what's causing this problem. But we can also use IVs like antioxidants, like glutathione is a great one. It's been shown to increase nitric oxide and to help with vascular health. And it does these things because it's basically clearing up the free radicals that are the source of the problem in the endothelial system. Free radicals from, again, diet, from heavy metals. So it's breaking apart and getting rid of, chelating out these heavy metals. And it's providing certain IVs like glutathione and poly-MVA are getting rid of the source of free radicals. There's NAD is one that I've been trying out a lot lately. It increases your mitochondrial health. So it's like, it gives you increased energy, as well as it has been shown to help repair those damaged, neurological receptor sites. And like from dopamine damage, they use it in alcohol addiction. It can be used for porn addiction from decreased dopamine sites because it's the same thing. So those are some of the IVs that I recommend, as well as supplements. There's antioxidant supplements we could take, and all these things are basically helping to clear out the free radicals that are sourcing through our endothelial system and are basically clogging or blocking our endothelial cells from producing healthy levels of nitric oxide. So it's a real holistic, curative, and preventative approach that gets to the root source of the problem without dangerous pharmaceuticals and surgeries and expenses too. I mean, in that study I mentioned before, where they estimated they could have avoided almost all of the bypass surgeries with just one course of EDTA chelation. They estimated they could have saved $8 billion that year. So these are also expensive, whereas we're talking about not relatively expensive. We should really be practicing this on a major level. And I do feel this is the wave of the future. The kind of medicine you're practicing and that the holistic medical field is practicing right now, I do believe is where we are going to be in the future. I think that the people are going to demand it. They're tired of not getting to the root source of the problem. They're tired of the side effects. They're tired of never getting healthy. They're tired of not feeling vibrant and vital, and they don't know why. There's so many myths and preconceptions and poisons really that, America is feeding us through corporations, and we've been really good. We're really good at actually practicing all these sort of, things that we're told to do by corporate America. We, are excellent at, mimicking the, or recording the mantras, the mantras that they're telling us that we should do. I think that's why we need to think for ourselves. It's important that we don't just take everything that we're told at face value by either a doctor or by corporate America. I think that we need to completely throw all this out and look from a scientific viewpoint what actually helps us, because the mainstream medical system is not accepting on a large scale what these chelation IVs can do for people and what Plaque X can do. In fact, the FDA continues to sort of hinder and harass a bit with trying to get these on through the naturopathic world. So we really, as a people, we need to demand that these are our lives. You know, nobody's life should be lost because of, you know, being pressured into using bypass surgeries and statins, you know. And there's a misconception around LDL cholesterol, that we think that's bad, but we're actually showing now that statins are interfering with our LDL cholesterol. It's actually produced by our liver to help as an antioxidant and antiviral for where we have free radical damage and endothelial. Western medicine is completely missing the root source of arteriosclerosis. It's coming from what we eat and the heavy metals and pollutants that are causing free radical damage throughout our body. And that's what's causing arteriosclerosis. And that's what's causing ED on an organic level. So that's the discoveries I've made. And you can also break up, I'll talk about EPAT. You mentioned EPAT, extracorporeal pulse activation technology. That's been very effective. We've been experimenting with that in conjunction with John Hopkins at a sexual clinic that I've been going to, with using it not just on the tops and sides briefly, which some people do, but actually going the top, sides, bottoms, the Alcock's canal, which is between the anus and the lingam, and the surrounding, like the mons pubis, which is above, as well as the chira, which is in the sides. Anywhere where we have supporting blood vessels and where we have capillaries in our lingam, it's been incredibly effective to break up plaque buildup in the lingam. So we're able to actually clear up a lot of these issues on all levels. You could take mild, medium, or severe arteriosclerosis, and when you combine it with a healthy diet and exercise, we can actually clear up from the inside out and outside in plaque and calcification and heavy metals, and build up the cause of these blockages in our system. Because right now, mainstream Western medicine is not resolving any of it with the statins. In fact, this one study is showing an increased deaths from cardiac arrest as well as cancers because of statins, because it's actually taking away our body's only protection from arteriosclerosis or from free radicals, which is So arteriosclerosis is really a symptom of damage that's taking place from free radicals, but mainstream Western medicine is not getting to the free radicals. They're bypassing that and just continuing to.
It's focusing on the wrong thing. I mean, I sat with a patient recently, and we were trying to decide about statins. And I'll be honest, I'm happy to report, and I'll be making a video about this probably even today, that the American Heart Association, when they review all the diagnostic tests that you can use to decide if you need to be on a statin or antiplatelet like aspirin, right? They made the decision that the coronary artery calcium score test was the winner in terms of a good predictor. And the win is that you will have a diabetic who will typically be given a statin as a default decision. And what they found in the studies is that the need to do that is not necessary if you have a 0 calcium score. So now you can at least take a portion of the people who are being asked to take statins with the side effects that you've mentioned and not be in a position to do that. But again, what I say to my patients is, cholesterol is something that helps to heal your cells and repair. And what's happened in conventional medicine is that it's like, just like the alien looking down on us from the sky. Whenever they see a fire, they see, fire trucks, right? So they assume that the fire trucks are causing problems. In reality, they're trying to put out the fire. And that's what cholesterol is. It's really there to help us. Now, too much cholesterol for reasons that have nothing to do with cholesterol, inflammation and oxidative stress, is why we have too much cholesterol. But if we certainly focus on why we have too much cholesterol instead of trying to get the fire people, which is the cholesterol in this analogy, we would do much better. So it's just rethinking. And again, my hope by having guests like you and learning the things I'm learning is that we start to rethink how we view these things, because if we stay in this tunnel vision that won't allow us to think outside of that, then we'll miss opportunities to help people. So I was really, intrigued by some of your comments. I agree that the body needs to have some antioxidant activity to balance the oxidation. I will say out loud, however, that the body is so complex, so you need a little bit of yin and yang kind of going. So you do need, so there are times when you want your body to have a little bit of a response, and then there are times when you want to put out that fire. Your body, I think glutathione in my training was like the master antioxidant, probably the most powerful, particularly in the nervous system, right? And it really does combat oxidative stress and helps to detoxify the body, et cetera. And I think we just have to think balance. And I say all of that to say that what better way to have balance than to have the right diet, than to have some exercise in your life, than to reduce stress, than to get enough sleep. So if you do those things, your need for external sources of antioxidants starts to diminish a little bit, because your body will have the capacity to deal with that quite naturally. One follow-up comment about going back to your semen retention recommendation for the right person in the right time. So, I kind of chuckle when I think about that, because all the guys I know, that's what they do it for, right? They have intimacy so they can release. So what you're saying, though, is that if it's done excessively, you're not saying, never do it, but you're saying if you release semen too often, that's going to potentially create a problem.
Well, it's funny because it's another one of these paradoxes where it actually does the opposite of what we think. It actually increases performance and sensitivity and enjoyment. It actually, most men ejaculate before women are just getting going. And so this actually increases your partner's enjoyability of the experience. But the longer every time this is the way I'd put it, that, ejaculation was really meant for more procreative sex, and, semen retention is more for recreational sex. So most of the time we're practicing recreational sex. We're not actually trying to have a baby, but we're actually, every time we are ejaculating, we're depleting our energy levels. And this is a whole nother topic, that recovering chi sexual energy is so critical for a lot of us, especially as we get older. Our recovery time is not as long, and so we start to get depleted levels of chi sexual energy, of our sexual energy, and this is physical, and it's energetic, it's everything. But basically, the longer you go, you develop other benefits beyond chi sexual energy, which is chi energy. So we're actually able to develop other kinds of what we call superpowers. These are really just these God-given qualities we have, which are, clarity, mood balance, inspiration, creativity, all these wonderful qualities that we're able to flourish in life, because we're not losing our chi energy. Our basically chi energy is life energy. It's like God inside of us. We're not just releasing that out all the time into if you're masturbating, it's just a toilet. But if you're with a woman, then it would be during sexual intercourse. But so long story short, I would say that personally, I have not ejaculated since I started this process, which was almost 3 years ago. And most men freak out when they hear that. Most people, I will say at this point, freak out when you bring up any of the healing modalities that you and I recommend. When it comes to dopamine addictions, whether that's food, or it's ejaculation, mating-based behaviors, or pornography, our brains are going to kick back hard when we try and strip ourselves of those addictions. And that's all part of the process. You know, people don't understand that there's a ton of myths around it. They, oh my God, I'm going to get blue balls. Oh, I won't be able to handle it. I don't even know what blue balls is. I think it's a myth, because really it's just your sexual energy. You're so used to just releasing it out all the time and externally that when you start to hold it in, you don't know what to do with all that excess energy. So you channel it into developing your passions in life, into your physical body, into your career, into your relationship. And that's where this transfers into relationships. We're able to practice Kareta, Tantra, or Tao, where we practice bonding behaviors based on, rather than the goal of just simply ejaculating, you know, climactic-based sex. That's just not really the end goal. We're just, it will happen, but it's not the sole goal. We're actually developing other bonding behaviors which are long lasting, you know, because again, getting into this whole mating versus bonding behaviors, it's a complex topic, but basically our mammalian brain has evolved over hundreds of thousands of years to develop two major behavior pathways, which is mating and bonding behaviors. And so the mating behavior is sort of this instinctive, you know, drive that we have to spread maximum genetic diversity with as many different women as we can. And it's really insidious to, you know, long-term relationships. So what these other Eastern traditions through, you know, have been practicing for millennia does is it supplants that with bonding behaviors, which satisfy that intense mating behavior we have, which we can't suppress. It's always going to be there, but it satisfies that while developing long-lasting relationships through the bonding behaviors, through semen retention, and through, you know, not totally driven towards just the ejaculation phase, but actually enjoying the whole process, the foreplay, the deep listening, the eye gazing, the caressing, the sensual play, the communication, developing these very critical relational behaviors, which our women are looking for, and they are starved for right now, because the pornography epidemic has created a relationship epidemic for women. And it's deeply saddening because women are unable to satisfy themselves on a relational level with men, because men are completely being destroyed by the neurology of pornographic and climactic driven addiction.
This is complicated because in order for this approach to work, it would require two people who understand what we're trying to achieve, because so many, I would imagine that a female who has a partner, and I know we have, you know, different ways of looking at this, but listen, if you have a partner who has not ejaculated, they may perceive that as I'm not satisfying him. So
yes, that's
if
right.
so we have to, you know, so if anybody takes this journey, you really got to have two partners who are completely fully engaged, understand what we're trying to achieve by doing this. Now, what's interesting, I know you had some addictive things you kind of spoke about that you were working through. Just like a person that's doing low fat or low carb, right? And they're making change, right? There's levels to this. So my question is it the level of commitment you've made where you're saying 3 years, right? What about a guy who has not had any, I'll say addictive behavior that has caused harm, just trying to improve their sexual function? Is it okay for that person to maybe periodically not release, but then, you know, obviously do it sometimes because there's some level of enjoyment? So I just want to clarify that because we have levels of people who are going to do this.
All right. So what I experience is a full body orgasm without semen ejaculation, without semen release.
Man, talk to me.
Okay, so what that means is you get the same feeling of ejaculation. You actually ejaculate, but the semen doesn't come out because during the process, you are, pulling out if you get too excited. You're prolonging the experience with your partner. And then when you get to that point of ejaculation and you cannot control yourself anymore, you practice the Kegels, which are the Kegel exercises I recommend in my book. Is been shown to help with organic ED, but it also is incredibly handy, I've found, for avoiding ejaculation. So what happens is your body shakes, you get a full body orgasm. You still get the same feeling of satisfaction from an ejaculation, but you don't have that. It's kind of, some people liken semen release to almost like a involuntary reflex where you're sneezing, or so all you're doing is blocking that semen from being lost, because that's where you get the intense cycles of depletion and mood imbalances and everything, is because of the actual semen release. So you can have everything the same, and actually you'll find that your sexual experiences dramatically increased. Even the size of your lingam, in conjunction with some of the other modalities I recommend, like Kegels and PRP, stem cell, and with HCG, which you use in conjunction with pellet TRT. These will increase the size of your lingam as more sexual chi energy comes to these areas, because I talk about bringing more energy from your chest to your lingam. As we age, we sort of develop atrophy from weight gain and loss of muscle. And there's actually a process that happens where you have decreased muscle as you gain more weight. With the obesity epidemic, it's sort of a spiral that happens. So, I'm on board with you with getting rid of fat. It's really important. And, I just want to tell people, look, I mean, when it comes to anything, whether you're hearing about this for the first time with semen retention, or it comes to pornography use, or it comes to our diet, put aside everything you've heard or you've been pressured to think by everyone around you. Peer pressure, cultural pressure, corporate pressure, whatever it is, that societal pressure. Put that aside and do what you need to do to become the best person you could be. Start fresh with a clean slate, a clear mind, and with God at your side, and do what you want to do. Start your own life and let others watch your life pass by, and be a model for them just by doing your life without listening to anything anyone says. Because I guarantee you, as you do these practices, people are going to say, wow, what's happening? Look at this. And sometimes it takes a while for people to even get that. Like my mom, when I lost all my weight, my fat, she still thought I was fat because people haven't adapted yet,
How much weight are we talking about?
Well, I mean, I had probably another, I don't know, I think it was around 30 pounds.
Okay.
Cool. Yeah. Okay. And I'm kind of where get rid of fat at all costs, because it's not helping us. And again, I just, I think I want to help people like you want to help people. Nobody should be dying. Nobody should be continuing to live unhealthy lifestyles because they're either afraid or they're being misdirected by society on what they feel is supposed to be doing. Mm-hmm. So I just want people to get their courage and determination. It's really about, I think all of us need to ask ourselves the question and make the deep connection between the suffering we're experiencing right now is caused by pornography, by food addiction, by, these addictions we have, and make that deep connection. Because when you make that deep connection to why you're feeling depressed and why you're feeling, you're feeling like your loss of confidence and identity, when you really get it, that's these bad habits are causing this, then that's the key to sustainably over long term quitting these addictions, these dopamine addictions. Because what we're talking about is quitting all dopamine addictions that are harming our dopamine levels. We want to have normal, healthy dopamine levels. We want to practice oxytocin through bonding behaviors. That's our goal, is to have healthy dopamine levels so that we can experience the joys of life and become the best people we can be.
Yeah, it's deep, and it's again, I think it takes a higher level of commitment to what I want my relationship to look like. And when you start having these kind of conversations, it will strengthen and make that bond stronger. And
I did that when I started my relationship. When I first started practicing this, I educated my partner on it, and at first she didn't quite understand it, but then she really fell in line with it when she made these connections, because it does take some time. It took time for me to make these connections. It took me a good month to start to really figure this out. A month.
Yeah. You know? I can believe it, and that's why it's just another opportunity to help us grow as human beings as we learn science, learn how to work with each other to heal. So some quick, kind of as we're getting close to wrap up. These are easy. We've touched on this. I just want to do some quick yay or nay, yes or no responses to a couple of things that kind of overlap. So true or false, ED is an old man's problem?
I do not believe that's true. I refuse to believe that's another cultural myth, because no.
That's right. Number 2, ED requires a specialist to treat.
Well, so far I haven't found a specialist that has treated it holistically on a body, mind, soul approach. Except myself.
Right.
So, answers the question.
That's right. And I think that's very important. And that's why I believe in a team approach. So if we have some folk in the functional medicine space, maybe, who see the world through a different lens, obviously you're in a completely different world and you're kind of innovating. We need some other people to take a look at it. But again, just depending on one type of specialist is probably not the right answer. ED occurs because of relationship problems. How do you feel about that?
Well, hold on. Let me go back to that last thing, because I want to tell you, even my naturopath doctor prescribed Viagra in the beginning. So we have a major systemic problem with addressing holistic sexual health. Okay, sorry. The next question? Is
ED primarily because of relationship problems?
Because of relationship problems. Well, no, as I've mentioned, it's neurological. It can be organic, and I have solutions for that for everyone. There's no reason to have the kind of stress and fear that I went through, the loss of identity and confidence I went through, because I laid a roadmap for all of you to avoid that.
Yep, totally agree. What about wearing tight underwear causes ED?
No, I mean, basically it can cause temperature differentiation, and I maybe wear boxers, but no.
Yeah, I completely agree. Maybe it affects fertility, maybe.
Maybe fertility,
but
yes.
It's definitely not ED. I agree 100%. Yeah. And I'm bringing these topics up because people have these misperceptions. What about
so many.
ED?
I mean, I want to say on that actually I think I'm going to lay this out, that our Western culture has most of the fundamentals wrong on every level. Diet, sex. I'm sorry, but we are really off base, and I'm trying to turn it back right side up.
That's right. As I am, I 100% agree. And I guess the last one is ED is not dangerous. What's your thoughts on that? Is it dangerous to have?
Well, again, what could be dangerous are the underlying causes of ED.
Right.
That's what could be dangerous. It's not a separate thing. People think that sexual health and pharmaceuticals are just this isolated region. It's all, our body is completely connected. It's a fascinating, orchestra of bodily systems and parts that are interwoven and function together perfectly.
I agree, and all your answers kind of suit exactly what I was gonna. As I was thinking about those questions, I said, yeah, that's kind of how I'm thinking. I'm curious if my guest feels the same way. So I appreciate those. And I guess as we kind of wrap up, when it comes to the nest and rope, nutrition, exercise, less stress, more sleep, how you think of recovering from trauma, having healthy relationships, avoiding organisms, pollutants, and protecting your emotions and your life experiences. You must serve. Where are you on your journey? I know you shared a lot about what got you here, but what's your focus over the next 12 months?
Well, as you can imagine, since I've written a book about it, I've been practicing all these healing modalities, and I recommend it to everyone. I recommend reading my book. I recommend, if you're going through the fears right now, the loss of identity and confidence from ED, that you keep my book close beside you. You highlight it, you refer to it to help you get through this process. Okay, I've shown massive transformations on sexually, through relational health, and my mind, body, and soul health, spiritually also. And I've been practicing all these modalities for years, and I've seen tremendous transformations with myself. And I'm done, I've looked at myself through testing, and I've cleared up any mild calcification and plaque that was gone. My sex life is incredibly healthy. I don't have trauma around it so much anymore, because it is incredibly traumatic what happens when people are going through this. And it's really an undue diagnosis burden that Western medication places on millions of men right now by, calling them, saying they have this sexual dysfunction, when really, a lot of it's neurological based from our habits, and whatever is organic, there are solutions. It's just that, and I provide those solutions. That's what my book is here for. So I'm actually doing very well health-wise. My exercise routine is very strong. When I talk about antioxidants and talk about cardiovascular, my blood flow is excellent. My blood pressure is excellent. I donate blood regularly. I continue to practice all the healing modalities in my book. I refrain from any pornography, even stimuluses that are virtual in nature, because those of us that go through this no-fap journey, we actually embrace reality rather than virtual life. We don't want to be those men that are glued to their telephones, their phones, and their devices anymore. We want to be living life. We want to face life head on without fear. We want to embrace our passions. We want to reclaim that vitality and youthfulness, and we want to reclaim our relationships. We want to have healthy, deep, connective relationships in life with our partner and with everyone that's in our life, and with God and with ourselves. But yeah, I've been doing quite well on all the different healing modalities, and I'm continuing to push myself to new levels, because that's what I do. I'm provided these healing modalities for all of you through my own process, and I continue to just push myself incrementally. Again, I don't recommend anyone doing anything drastic in the beginning when it comes to weight training or anything. I recommend, just a slow, methodical process, because that avoids injury. And it also avoids just giving up. A lot of people do 1,000 sit-ups and they can't move for a week. Right. It's like, we want to avoid that. We want to just be consistent on it. And that's what I've done. I've worked up to, 200 sit-ups a day. I do weight training, and I'm not trying to become a giant guy. I'm just trying to have overall physical health. I want to have good blood flow, cardiovascular, endothelial system, and I want to have good neurology. Yeah. So I hope that answers your question.
I appreciate all of that. And I think this is awesome. And I'm going to let you wrap up. I'm actually going to get my power source, but share with the audience where you can, where people can find you.
You can find me on my website, brookehazen.com. That's BROOKEHAZ, like zebra, EN, like Nancy, brookehazen.com. And that's where you can find links to my book, which will be out April 9th. I have audio in my own voice. I have paperback and Kindle. I also have it in the Kindle and paperback in Spanish and Chinese. So I encourage you to buy it and to refer to it to help you through this process, because I understand more than anyone how incredibly difficult this process is, overcoming ED and all the myths and preconceptions around it. What I'm doing is trying to empower you that you are not broken by any means. You are actually a powerful and sovereign being capable of accomplishing anything you put your mind to.
Well, that was perfect. And thank you for kind of allowing me to make that adjustment. So I appreciate you. This has been eye-opening. I think anybody who is hearing your voice, I just ask that they open their hearts and their minds to seeing the world through a different lens. I think everything that's made my life better is being open to seeing things differently. And that's why I love having guests like you who share a different perspective. And that perspective is going to hopefully help somebody listening to heal and to maybe even get closer to that special someone. So thank you so much for joining me today, and I really appreciate you. Thanks so much.
Yeah, thank you so much for having me on, and thanks to God.
Hey, that's what I wanted to hear. So thank you so much. And as we wrap up, guys, we appreciate you joining us today. I do have a question for you. Do you know someone who is interested in having a better sex life? And if so, this may be the perfect episode to share, because we all deserve a healthy sex life. And as you heard from Brooke, it's a little deeper than just sex. So today we learned about some additional ways to improve our sexual health and really gain some new insights that I think will provide hope, And it is my hope, is Brooke's hope, that, you won't just sit on the sidelines anymore, but you'll use this newly found knowledge as inspiration, that you can act on so you can start your path towards a healthy sexual life. So whether you do this by purchasing Brooke's book or, having a conversation with your clinician who understands that there are different approaches, I hope that you take advantage of this opportunity to do just that. So again, so happy that you guys joined us today. And as I conclude, I only ask that you continue to be safe, be well, and continue to protect your nest.